there's one thing I usually say to people that if you want to be something, but you also have to become it. So it's you really need to be dedicated and motivated to really go for it. I think if you do that, you will get there.
Welcome to Inside the Shoulder. I'm Kenneth Cutbush, and I'm with Freek Hollman. Freek is a Dutch surgeon from the Netherlands, and he's joining us live from the Netherlands. How are you, Freek?
Hi Ken, I'm great. Thank you. Uh, Thanks for having me.
Yeah, welcome. It's great to see you again. Which city are you joining us from?
So at the moment I'm in the 's-Hertogenbosch. It's in the south of the Netherlands, and it's cold and rainy at the moment.
Well, it's nice and sunny here in Brisbane. Freek, so do you think you could tell us a little bit about what initially drew you to shoulder surgery and a career in medicine?
Yeah, so I started medicine, I think mainly because my dad also is a doctor. My mom started medicine, but she didn't finish. So I think I took it from there. And together with my brother, we both became doctors. We just wanted to help people and do a great job for them. And well, then actually during my internship, first internship, so we actually start already during the third year of medicine with internships. And I got involved in an ACL reconstruction, and all the technical aspects and solving something quickly and the connection with the patients just shortly with an operation could or not could do the job. And that really triggered me to go deeper into orthopedics, and from there I got interested in shoulder pathology because of a research project. And I don't know, sometime at that point, I just got more and more interested in shoulders. And at that time, I got focused. I got figured out that if you just put all your effort in one thing, you can accomplish more. So that's what I did. I went for it and want to become a shoulder surgeon.
Right. What was the project in shoulders that you were doing? What was it that got you interested in shoulders?
So it's just a very complex joint. It consists of like four joints in one joint, and they all need to work together to be able to get your hand into space. And if one of them doesn't work, and it's your job to find out which one of them it is, and then you might need to do something. And there are a lot of different kind of pathologies that you can find. It's very diverse population, diverse kind of surgeries. It's not like hips or knees for me.
Yeah, I think you're right, because I don't think people realize, like, we're able to, as humans, able to do this, which is a very rare thing. Most animals, well, other animals can't do that. It's only us and the great apes, because we have a rotator cuff and we can get from here, and the scapula rotates. We finally get all the way up there. I mean, even the lower order monkeys, they lift their arm up and then arch their back to get their arm up. And having that shoulder allows us to put this wonderful thing, our hand, in space wherever we want. And it really is a wonderful joint, isn't it? It's really fascinating.
Yeah, it still is. And the more you know about it, the less you know about it. Sort of, yeah. It just keeps evolving, and that's awesome.
So what did you have to do to get onto the orthopedic program in the Netherlands? What's that like? It's pretty competitive, I would imagine.
Yeah, it's quite competitive. So I think in Australia it's more competitive. In the Netherlands, it's easier to get enrolled into the program. It takes you about like 1 year or 2 years of non-trainee things, and it's preferable if you have finished a PhD or did some other like Olympic sports career or whatever. Just to do something special. And then you can become a surgeon. But after that, it becomes difficult at this point. So it's difficult to get a job as a surgeon. Like at the time that I finished, almost half of them didn't have a job.
That's amazing, isn't it? After all that training, that that study, and all the exams and everything, to think that 50% of the orthopedic surgeons in the Netherlands are having trouble getting jobs, or 50% of the ones coming through.
Yeah, yeah, yeah. Yeah, it's getting better now. So the people are getting retired, and there's more job availability, and in other kind of practice forms. So more the like the it's we don't have private, but there's a sort of intermediate private system where you can also work as a surgeon. So that also gave a lot of new jobs, I guess. So the problem is getting less, but it's not in Australia, but it's difficult to get enrolled in the program there. So there, I mean, it's just a difference. Yeah.
Yeah, okay. And so where are you working now?
So I'm working in Venlo. It's about an hour drive from here. I mean, you know
Yeah,
how far it is.
we just visited recently, didn't we?
Yeah. That was great. So we joined. Yeah. So it's like an hour, and it's a great hospital in Venlo. It's a bit more to the east. It's a teaching hospital. We have residents. We've got fellows from all over the world. And we've got a very nice group of 8 surgeons, orthopedic surgeons that have different kind of specialties. And together with my mate Okke, we're doing the shoulders together, and we are a shoulder expertise center. So we get a lot of referrals from the region, and that makes it a very interesting job for me
Mhm.
to work there as well. It's I can practice my hobby sort of.
Hmm. Yeah, well, how long ago was it? It was only a few months ago that I actually visited you, and we had Roberto Parion from Mexico, one of the other fellows, and we did some surgery together in the Netherlands. It was pretty cool, wasn't it?
Yeah, and they're doing also pretty well. I've seen them back now after the
Yeah,
operations,
right.
and so we did a good job together.
Yeah, it was really good. So, how was what drew you to come to do a fellowship in Australia, Freek?
Yeah, so this it's also because of the focus. I just want to become a very skillful and well trained orthopedic surgeon. I didn't want to I mean, I can find things out myself, but I just wanted to learn from the best to have that solid base of practice and have tools available to make the correct decisions and treatment options for my patients to do best for them. So that's why I wanted to do a fellowship, and there were a couple of options out there.
Yeah.
And I asked my wife, also enrolled her in this in the choice. And well, if you ask her where you want to go, and one of them is Australia, it's
Hmm.
not that difficult to go for that. And I was lucky to be selected to join you.
Yeah, it was great to have you. So, what was that like coming to Australia with your family? You know, you've got 2 daughters, your wife. What was that like?
Well, it was great, but then we were directly kidnapped and put in a hotel for 2 weeks because then at the time COVID hit in.
Still COVID, was it? Yeah, right.
But I was able to look at your hospital for about 2 weeks from the hotel. But after that, I mean, just it was amazing. It's a very nice city. It's Brisbane, and the whole team and the collaboration with Quasar and with you and
Yeah,
Ashish at the time. It was
yeah.
just, yeah, it was great.
And yeah, how did you prepare for that coming to Australia? Was that a big logistical problem?
Well, I was pretty busy in the last year. I had to finish my training program. I had to finish my PhD. I was part of the board of the Fortis, orthopedic um, society for residents in Europe. It was quite a lot. So then I also had to pass my IELTS exam.
Oh, the English exam, yeah.
Yeah, and I mean, I did it 5 times. So, and I started on
Really?
time. Yeah, and every time I failed on one on another um, uh, part. So, but in the end, I just wanted I had to pass. So,
Yeah, I didn't realize it sat that many times. I mean, for those listening, the English exam is very important for fellows coming to Australia. It really is one of the big stumbling blocks. You have to have such a high level of English, don't you,
yeah,
to come and get registration in Australia.
and the rest is pretty clear. I mean, the AOA is very helpful, and in the case of your fellowship, it was you had a secretary Emma at that time that was really helpful in getting things organized. So it was net made it easier not to skip one of the tick boxes you had to complete.
And the family, what was like with the kids going to school in Australia?
Well, they were very young, like 9 months and 2 years, I guess.
Oh, right. Yeah, of course. So they weren't. I thought one was older than that.
So one of no, yeah, so Lieve went to a Dutch school for like
Yeah.
one day a week, and it was fun. But it was just fun. For my wife, it was hard to take care of two kids, and then in the
Mm-hmm.
evenings work as well at her prior job
Mm-hmm.
digitally. So as a family, we also we were a good team. You need to be a good team together to go through all this, and
Yeah.
there are struggles as well, but we survived. Yeah, and the kids as well.
And then you went back to the Netherlands, and you got a job straight away, didn't you? You actually had a job before you went back, so that you were one of the lucky ones.
Yeah, I was very lucky because it was in March that I got that job, and it made also the stay in Australia a much more relaxed because that I had the job lined up. They wanted to get me back a bit earlier. I said no, I don't want to come back, and then they said okay, well you can stay, and that was cool. But and well then we came back, and there was a sort of there was a shock. I didn't want to go. I didn't want to go. I wanted to go back. But yeah,
You were saying you wanted to stay in Australia.
I would stay. Yeah,
Oh,
yeah,
really?
yeah. I mean, we love it here. It's the Netherlands is a very nice environment, and we're close to family. But Australia is just a very, I mean, for us, Brisbane was just a very happy place.
Yeah. And your wife liked it? Was a good experience for her, was
Yeah,
it?
yeah, yeah.
Yeah, right.
Met a lot of friends, and we
Yeah.
had a good social life.
You have Dutch friends here?
We've got some friends in Brisbane. Yeah, yeah, yeah. So that not it's like Aussie friends.
Oh, Aussie friends.
We actually get in touch with the Millmans. There's a very
Yeah.
like John is one of the tennis players,
Hmm.
and they got a bunch of sisters, and my wife went out with them a lot of times, and they have a book
Hmm.
club, and so she had a good life as well there. Yeah, life was happy.
Can you tell me some of the lessons you learned in the fellowships that were valuable or helpful when you went back and started back in your own practice?
Yeah, so the culture is a bit different, as in like terms of training program. I found out we are a bit softer, so it was good for me to toughen up a bit and grow some hairs. And I'm trying to get these things also a bit enrolled in our system, but it's
Like what, Freek? I thought the Dutch were very sort of, robust and firm, straightforward.
well, it might be a generation thing. I don't know.
What are you trying to introduce to the Dutch system?
Yeah, what I experience is that like we are very conservative. That's in terms of like
Yeah,
treatment. We are, and
yeah.
I just believed in stuff that I've learned, and I wanted to do it as the way I've learned it. So I had to also be a bit more, yeah, uh, believe in myself and believe in what I've learned, and just do that. And so I was criticized quite quite a lot actually in the beginning, and but it just kept going.
That's when you went back to Netherlands.
Yeah,
Yeah, right. Like what?
yeah, like doing the arthro lagere, doing like principles in reverse shoulder arthroplasty,
Hmm.
brachial plexus release. People say you're just crazy. I mean, you got a good solution for a kind of problem that people don't understand, and it doesn't mean you're
Yeah,
crazy.
yeah.
Um, and yeah, and then I mean, training residents in a way you would like to train them as well, the way you've learned it. It's sort of like finding a mix of both worlds that work well
Hmm.
and fits you. Because I like the way people were trained, like fellows were trained by you and Ashish as well. I mean, you train surgeons very well, and that works. So I just
Yeah.
don't change a winning team.
Yeah. And so you took back brachial plexus release. So this is for releasing the brachial plexus front of the shoulder for for anterior shoulder pain, and you're actually teaching that now at the end of the shoulder and elbow society of Europe, the CSEC. You actually ran a course, didn't you, with a colleague?
Yeah,
How was that?
yeah, that was great. It was a busy week, but and we finished that week with a full day of live surgeries together with Jose Carlos Garcia from Brazil and Carlos Maia Diaz from Portugal, and It was intense and good. I've learned a lot of things about it, and it's actually also broadcasted on BMET. So if
Yeah.
people want to review it, then you can also watch it on BMET. But it's rapidly evolving. There are a lot of people involved all over the world to getting endoscopic brachial practice release. Yeah, more into more familiar with shoulder surgeons.
Right. So you've actually got live surgeries available on that BMed platform for doctors to
Yeah,
watch. Yeah,
correct.
pretty cool. And now you were telling me at the beginning that you've got an award for your scientific endeavors. Can you share that with us?
Sure. I've polished it a bit before, which is good.
So what's this, Freek? Tell me
So
about it.
this is a reward that's has been given I think once in 2 years to a orthopedic surgeon with the best research project. For example, for a thesis. So that was in my case on optimizing care on rotator cuff pathology and all the other research that we've been doing in our 3D lab in Vicurie in Venlo. And also some other proof. We got a lot of PhD students, and there's a lot of things going on there.
So what's the name? What's the name of the award?
It's a Matthijsse Prijs. It
And
was
who's
one of the
Matthijsse?
yes. I expected this question, but I assume he was one of the first masters of plaster, like the POP guys
Hmm.
working in the Netherlands, and he was also a general. Um, and he started with like casting people, and because it's one of the foundations of orthopedics. Um, they give they name the prize like that.
Very good. So just moving on, what advice have you got for uh, young guys and young women wanting to do orthopedics in the Netherlands? You know, how do they go about doing it? Would you encourage them to do it?
Yeah, there's one thing I usually say to people that if you want to become something, but you want to be something, but you also have to become it. So it's you really need to be dedicated and motivated to really to really go for it. And if you not go for it 100%, yeah, you don't motivate people around you. It's I think if you do that, you will get there. It's a dedication, and I mean, if you have the skills and you believe in yourself and people believe in you, then you can make things happen.
Now, you had to do a thesis during your orthopedic training.
So you need to do at least like one research project
Yeah.
to finish your training program. But it's not necessary to do a thesis like a proper research, like write a book.
Hmm.
So I wrote a book, but it's not everybody needs to write a book.
And that's what you got the prize for, was it the thesis?
Yeah, yeah,
Yeah, right. And your book that you wrote was on rotator cuff, wasn't it?
yeah, yeah. It was like optimizing care on rotator cuff pathology, like,
Hmm.
and there were like 8 chapters with 7 papers that got published, and
Oh, really?
yeah, and I finished that just like 1 month before going to Australia. So
Yeah.
that was stressful to getting that over the line.
I mean, you gave me a coffee.
Yeah,
Very good. I've still got it with me. Um, and then, and now you're training fellows where you are in the Netherlands. Who have you got working with you?
yes. At the moment, we've got Sarta Gupta from India. He's with us for 3 months, and that's usually what we do. It's an ISOCOL supported fellowship. So young guys that like trainees or guys that just finished a training program, or people that just
Hmm.
want to get enrolled and get more like from less shoulder developed countries, and they want to expand their skills on shoulders, they can visit us. And we've got also a bunch of people from Mexico, and that mainly because of the collaboration with Roberto, one of the well, my co-fellow during the stay in Brisbane.
Yeah.
We exchanged some fellows, and it's very fruitful, and we'd like to train them. Yeah.
Yeah. So good. Um, And so, what's life got in store for you now, Freek? What's exciting? What's on the horizon for you?
Well, I'm pretty happy actually at the moment. My family life is important at this point. I mean, I've worked very hard the last couple of years to get things done. Now I think it's also time to relax a bit. Looking in like 5 to 10 years in the future. Um, Perhaps some more like senior roles in research projects. A collaboration with technical university, and perhaps also Dutch um, fellowship program. That would be nice.
What do you mean by a Dutch fellowship program?
Yeah, so for now we're training, like it's an unpaid fellowship, and we're just like training people from all over the world,
Hmm.
and I think it's also good with the experience we have to train Dutch surgeons that finished their training program recently to just come with us for like a year, and even after going abroad and then getting back home, getting some more practical exposure if they have lack on that, and they want to be more comfortable before starting their own practice. That's what I would like to have, and
Hmm.
perhaps get enrolled in for myself. Perhaps get enrolled in like, organizations like CSEC or ISACOS.
Yeah,
But
right.
yeah, that's but first things first. I mean, it's been pretty crazy last couple of years. So
Yeah, right.
for now, it's I'm happy.
And surgically, arthroscopic lattice, is that something you're planning on continuing with?
Yeah, for sure. I mean, I have to confess that the literature is supportive for both techniques.
Yeah.
I see the advantages of arthroscopic. It just increased my skills enormously as a shoulder surgeon. Um, and so I for the for now I just keep doing it.
Yeah.
Uh, and It's just that the reverse shoulder replacement you can't do that arthroscopically, but the rest you can
No,
do all.
no, you can't
Uh,
do that arthroscopically. Are you going to try and do the minimally invasive reverse shoulder replacement, leaving the subscap on? Have you looked at that?
I don't know how.
Yeah, I've looked at it. I don't. I think for an arthritic shoulder, it's very difficult. Yeah, maybe a shoulder that's got a cuff tear, maybe.
Yeah, depends on the design perhaps as well. We use Artrex, and I think you use Medacta, right? That's
Yep.
yeah. So it depends on the design. If you leave the scup cap on, I don't know. It's it's easier to take it off and suture it back.
How many children do you have now? Is it three?
So there's now one boy with a stamp on his buttock, made in
Yeah.
Australia,
Two girls, one boy. Yeah.
and one boy. Yeah. So the answer is just two, 4, and 6.
Hmm. So do you see a future for them in medicine? Are you going to encourage them down that pathway?
Yeah.
What are your thoughts?
Well, my boy always hammers with a hammer the whole day in the garden. So if he wants, I'm highly supportive for him. It's just it's a nice job, and I hope that medicine will will still be very interesting for young guys
Yeah.
to get into that.
Yeah, when I was
Yeah.
a little boy, my father liked building things onto the house and doing renovations and so on and doing landscaping. And and so as a young kid, I had power tools in my hand and, circular saw, circular saw is probably the most dangerous thing you can have. I've got a photo of me at age 10 with a circular saw and, drills and power tools, of course. And if we weren't doing that, we were doing pottery sculptures on the weekend. So it was, yeah. So
Great.
maybe that's the way to go, Freck.
I'll think about it.
Upgrading
Thanks for
from a
your
hammer to a
advice.
power tool. Yeah. All right. Well, wonderful, Freck. So good to see you.
Yeah, good to see you
Do you
too.
have any closing remarks for people that on a career in orthopedic surgery and in shoulder surgery?
Yeah, if you want to accomplish, go for it 100%. I
Yeah.
mean, and keep work life balance. Yeah, in your mind. That's also it's easy to go for a job, but don't lose contact with your family.
Yep. Yeah, definitely don't want to do that. So, Freck, thank you so much for coming on Inside the Shoulder. It's really good to see you again, have a chat.
Thanks for having me, Ken, today. Thank you.
And to all those listening, Please like, subscribe, and share on your favorite podcast platform, whether it be Spotify or Apple or YouTube. And please subscribe to Kenneth Cutbush YouTube channel. Thank you for listening.